Welcome to our webinar, Optimizing Healthcare Outcomes with Zoho's platform. So we are truly excited to have you here today as we discuss how technology can make a real difference in the lives of doctors and their patients. Our objective today is to provide you with an in-depth look at Zoho's comprehensive suite of tools and how they can address critical challenges in the healthcare industry. So here's what we have planned for you. So first, we'll begin by introducing you to Zoho's applications in healthcare, and then we will focus on 2 to 3 critical challenges facing the healthcare industry and show how the Hithav Zoho partnership offers effective solutions. And then at the end, we will wrap up with a chance for you to ask questions, and then we'll share your thoughts and insights. We know that as a healthcare professionals, your days are filled with challenges, and from managing patient care to navigating complex systems. So this webinar aims to show you how Zoho's tool can help that lighten that load. So together we will explain how these solutions can improve your workflow, enhance patient communication, and ultimately lead to better health outcomes. So by end of our session, you will learn how technology can support you in providing the best care possible, and you will also get the understanding of how specific challenges you face and discover practical solutions. And you will also develop a simple plan to integrate these tools to your daily practice. And you will also get to hear the best practices from our experts who have successfully implemented these solutions. So let's work together to make the healthcare easier and more effective for everyone involved in this webinar. And once again, thank you for being here, and let's get started. So before we dive in further, I'd like to introduce our distinguished panel of experts who will be guiding us through today's session. First, we have Karthikeyan Manikyam, the Partnership Marketing Manager from Zoho Corporation. Hello, Karthik. So Karthikeyan brings an extensive knowledge of Zoho solution and their applications in various industries, including healthcare. And next, we have honored to have Mangalamapalli and Narasimhamurthy Garu joining us. So as a healthcare, pharma, and biomed industry expert, he brings a wealth of experience and deep understanding of how specific challenges and opportunities in the healthcare sector. And next we have, last but not least, Raghu Patri, the Chief Revenue Officer at Hithav Partners. So his expertise in leveraging technology for business growth will provide valuable insights into how healthcare organizations can optimize their operations and also solving their challenges. So these experts will be sharing their knowledge and answering your questions throughout the webinar. And we will explore how Zoho's platform can transform the healthcare delivery and management into the operations. So now I'll hand it over to Karthikeyan to start us off with an overview of Zoho's healthcare solutions.
Yes. Is my screen visible?
Yes.
Yes.
Yeah. Okay. So, good afternoon, everyone. Thank you for joining today's webinar on how Zoho could help transform the outcomes or optimize the outcomes in healthcare industry. So, I also have one of my colleagues along with me, the partner account manager for the India region, Mr. Pritham. So, share his knowledge. So, let me take you through the presentation. So at Zoho, we have always believed in challenging the status quo, especially in industries like life sciences, healthcare, pharmaceuticals, which often face barriers such as inaccessible, complex, and costly solutions. These hurdles inspired us to develop software that simplifies processes, breaks silos, and delivers value at every level. Zoho, rooted in India and guided by our vision of sustainability, was created to offer simplicity and long-term innovation. So we are made from India, but made for the world. That's how we put it. And from our humble beginnings with a single product, Zoho has grown into a comprehensive suite of over 55 applications, all built in-house to tackle the most demanding business challenges. Today, Zoho powers organizations of all sizes and sectors, including pharmaceuticals, healthcare, and life sciences. Our commitment to R&D has been the driving force behind our innovation, allowing us to deliver cutting-edge solutions for over 25 years. So we are present in multiple countries. These are our global footprints, and we consider the customer privacy and their security policies to be of utmost importance. So we have our own data centers in various continents. And as you could see in the graph, we are continuously innovating and growing, not just in terms of the number of products, but in earning the trust of our customers and organizations as well. Zoho One, our flagship product, is more than a collection of applications. It's an integrated operating system for any businesses. It addresses critical challenges in sales, operations, compliance, and data management. It streamlines and connects business functions right from CRM, inventory management to project tracking, finance, and HR, making it an all-in-one platform that eliminates the need for disjointed systems. Especially in industries like pharma, healthcare, regulatory compliance, and data management are key priorities. Zoho One simplifies compliance management with built-in tools for tracking regulatory requirements, managing documentation, and ensuring data security. This is particularly vital in healthcare, where non-compliance can have serious repercussions. Our platform also empowers organizations to securely store and analyze large volumes of data, from clinical trial information to patient records, helping ensure data is accessible, secure, and actionable for informed decision making. So that's the major part of what I wanted to say, and why choose Zoho, right? So we provide the most comprehensive business application suite in the industry, and Zoho's approach is also rooted in long-term customer relationship. We focus on creating value through continuous innovation, with all our products developed in-house rather than through acquisitions. This ensures our ecosystem grows along with our business, adding new features and capabilities that drive efficiency and growth, right? So as we said, it's crafted into our products. What I mean was it's a totally stitched, integrated platform. Therefore, hearing the unified software is more than a buzzword. It could give you a very measurable ROI across the business units, which would clearly indicate manifold improvisation in your productivity. So these are some of the brands, global brands that trust us and has invested in us, and we'd love to help you with your digital transformation journey. Thank you. And I'm handing it over to Tejaswini and Raghu. Please take it over. And once again, I welcome you all. And as we dive deeper into how Zoho can solve challenges in your industry, please know that we are completely committed to helping businesses in life sciences, care, and pharmaceuticals transform their operations, stay compliant, and make data-driven decisions. Thank you for joining us today. I'm extremely excited about the discussions ahead.
Right. Thanks, Karthik. That was very insightful. I mean, it's always exciting to see what Zoho does. And yeah, so you see, the beauty of Zoho as a product, is what exactly what Karthik spoke about, right? It's ability to interoperate with different applications, and these applications, while they all stand alone, we still look at them as something that is required. We cannot operate in silos. So I'll just explain a few of the benefits that Zoho can provide, and especially in the healthcare, because healthcare is an area which is of critical importance. We cannot have we cannot afford minor mistakes. We can't afford to, and then the amount of precision that is required is extremely high. So one of the larger things, or one of the challenges that that we typically see in this environment is how to optimize. Right? I mean, that's the entire focus of healthcare works on that. So having a proper patient relationship management, or proper scheduling, telehealth integration, because today in today's world, healthcare is not just about being able to come to a clinic or a hospital and deliver. It's our ability to reach out, to we've seen success across multiple platforms. Let's say like Practo, and just revolutionized to a large extent the way we can deliver healthcare today is more. And then especially during the COVID time, we found out that there are easier ways to come across this. So that all these become a part of your entire optimizing of your patient care. Then streamlines your operations. I mean, you look at the way data is stored, because from a doctor's perspective, you look at data about the patient as possible for him to be able to take informed decisions about how to go about giving the right treatment, and the precise kind of what should I say, information that is necessary for him. Unless he has a proper workflow which is ensuring that all the documentation is required for him is coming to him the way it's going to be a challenge, right? And enhancing marketing and communications. Typically, most healthcare practices, fail in this respect, because, if you take a look at especially the smaller and the medium-sized clinics, they have high specializations, and having high specializations means that you need to target an audience who has those particular ailments, which can ensure that it may not happen at a particular point in time, but then these could come up at different stages in their life. And unless they're aware of what is happening, or what is the clinic or what is the hospital which can serve these requirements, it's a challenge for hospitals to be able to attract the right kind of patients coming in there. So that's where Zoho can play a role, because the whole thing is integrated. Given the patient information is available and the history is available, it's easy for let's say a clinic or a hospital to go and say, hey, since you are suffering from a particular problem, if you come across this in the future, then this is where you can come back to us. And then that enhances that whole experience for a patient, because if he's got a trusted hospital, then he would be happy to come back and get diagnosed on or treated for ailments which could be recurring in the future. And lastly, of course, this is always a challenge: enhancing financial management. Typically, billing is a complex structure, and then chartered accountants tend to ask for different questions, and then the clinic has a different way of looking at things. So always integrating those becomes a challenge. But with Zoho, everything is important. So we look at this as a whole solution. Zoho addresses these aspects very, very clearly, and it becomes easy for us to say, hey, as a healthcare service provider, I have this one solution, I'm addressing multiple problems, and the whole experience becomes, that's what we're looking at. We talk about healthcare. Can we move on to the next slide, Teja? So what we'll be doing is that we'll see how to overcome all these challenges, typical challenges that are being faced in the industry. Right? Right. So one is, typically what's happening today is, patients have very increasing expectations, right? It's unlike, let's say, 15 years back or 10 years back, where a patient would have been happy with, a certain set of services. So today, the expectation is higher. The challenge that they have is not access, but, what's the quality of care? Am I getting a certain kind of care that I'm looking for? The demands that we have from a patient today is much higher. Like, for example, if they go to a particular clinic for certain treatment, then they would want to say, hey, if you're going to subscribe a set of tests for me, then can I get it done right away, or do I need to go to a different place? Many clinics offer this facility, but many clinics don't offer it. So they would want to choose something that makes it convenient for them, right? So today, expectations is much higher. And also, once they give out, let's say, their blood or urine or whatever for a test, then expectation is that, how do I want my information back? How fast do I want it back? In what manner do I want it back? Nobody's happy with printed documentation anymore. They want it in electronic formats. And we'll come and address those issues. There are things that we'll talk about there. So managing complex patient data records, that's another challenge, right, that most clinics face, because, in many cases, let us say some of the history may not be relevant. Let's say, for example, in the case of a diabetic, well, the diabetic tracks his own blood sugar, it keeps track of it. The historical importance may not be very, critical, because it's for the moment, right? Today and right now, what is my current status? And that's important. and that's when a diabetic patient would come in. But if you have a patient who's got a history of heart disease, then there is a different challenge, because then they need to understand not just his history, maybe his parents' history, his grandparents' history. What is the history of cardiac risk family? What are the challenges they face? Other health issues, and these are deciding factors for doctors to understand what could be the optimum treatment to be given to them. So there is each diagnosis changes. Every kind of a disease has a different kind of diagnosis, which requires or doesn't require historical data, and getting access to all that can be a challenge for doctors, especially when patients move from one clinic to another, and maybe want a second opinion, maybe want enhanced thing, and sometimes some clinics do not offer all the solutions that they look for, and they have to go somewhere to get us part of the treatment on there. And the bigger challenge for this data is there a privacy and security option available? Because look, end of the day, it's something that is very personal to to the individual, and they don't want to disclose this data to everyone, and it is something that they have to manage on their own. So those are concerns which are very, very large, not been addressed. Maybe 25 years back, it would have been okay for a doctor to go and talk about a patient's ailment to a family member, because they find it difficult to talk to the patient and explain to them the criticality of the situation. But in today's world, that's no longer acceptable, because the choice, the decision of their treatment is on the individual. The person who is suffering or who is undergoing an ailment needs to address these issues, and not a relative, it could be anyone. It could be a husband, it could be a father, it could be a son. That doesn't make a difference. End of the day, it is the patient who has to make the decision. And culturally, we have a different approach to it, but that is slowly changing, right? And then, so these are issues that we need to actually address when we talk about data privacy and security concerns. And then the challenge that most clinics face, as we see, legacy systems and technology limitations. You started using something a few years ago, and then there's a comfort factor which kind of settles into this whole aspect of thing. And okay, I know this works. It has its limitations, but I'm like, okay, I'll live with it. I'll manage. But these things are changing, and we're able to provide much better, much more integrated, much more time saving, much more critical, what should I say, delivery of requirements is being done by solutions which are newer and faster and easier to work with as we get. Next slide, Teja. Right. So I'll just quickly talk about some of these, and Karthik has already covered the solutions that Zoho can provide on that. So one of the challenges that we look at is patients are increasing demand personalized and convenient health experiences, right? They no longer wish to go and go to a hospital or a clinic and then find out that they have to wait for hours, or they have to do this and and then not get the kind of treatment that they want. Today the experience is very different. So we see that specialization is a very big thing that is happening, and patients have bigger expectations when it comes to managing their healthcare. Next point, Teja. So the other challenge that we looked at is the interoperability of data. This is a very, very big challenge as we see today. There is a new law which is coming in, and over the next 6 months we will see this change get incorporated into the systems in India. The law typically will move to a situation where it will become mandatory for every health provider to provide records in a very interoperable format. Now we're talking about, I'm not trying to use complex words, but the very word interoperable means that today you have a system by which you are able to capture the data and store it, right? Which is good. You can read it, you can understand, you can share it with your patient, and they can understand. The job doesn't end there. What happens is this data tomorrow needs to be used by another doctor for a different purpose. It could be for whatever is the choice of the patient. Maybe he's not able to get the subsequent treatment in the same clinic, or he's not able to, he's not very happy with the kind of opinion that he's got, and he wants a second opinion on that. Or he says, no, you know what, I'll just get this whole thing started again because I have a different approach to this whole thing, right? So then when this information is to be shared with another doctor, then the challenge comes in, because today it's all done through physical records. So you take a printout of them, or you have a PDF copy which you carry and then hand it over to another doctor, which may not be the most optimal way of doing things, because then the doctor has to go back and he has to physically read these things, or summarize these, and it's very difficult for them to figure out how these things work. And in many cases, doctors also come back and say, hey, you know what, I don't trust that clinic, so because I don't know what you've given me, whether you've done it right or wrong, let me do these tests all over again, or let us go through this whole procedure again, which is a dual effort. It's a double expense for the patient, and while it's maybe to a large extent taken care of in their insurance, but still it's an expense which they need to account for on that. So today the scenario is this, but it's going to change in the near future, and that is where a solution like Zoho will make it very, very super easy for you to work with, because not only will you have the privacy challenges worked out, but also the interoperability as per the standards that are there, which are going to be coming up, evolving, will be built into the system. So that makes it very easy for you to work with on. Next slide, Teja. Last thing I'll talk about is growing data security and privacy concern. I'm sure a couple of you like to see India has gone and changed the way we talk about data today. Not just in health, but your entire personal data in general, right? India has got one of the best laws ever, which has been introduced to ensure that data privacy is something that you have to value. Right. And given those kind of the trust is coming from the government to ensure that it goes down to grassroots levels at different parts. And in healthcare, it's all the more critical because, like I said, it's something that is very personal to an individual, and we should respect it to that extent, right? I mean, it's not right on our part to try and make it a public issue, or try and see that if we can share this whoever is there. These issues need to be addressed very, very strongly. And protecting sensitive data from breaches and ensuring compliance with regulations is a very critical aspect that any health service provider has to ensure that they happen. Forget it being just a social issue. It's now becoming mandatory by law, and that is where we have to ensure that as going forward, we have the right things to ensure that data is always protected. So these are some of the areas that we see are challenges we will face, and and Zoho has this ability to address these challenges. Right. So I'll conclude my bit of my talk here on that, and I would like to invite Mr. Murthy to come and. Mr. Murthy is like Teja introduced, is an industry expert who has spent decades, not just in pharma, but the beauty of his experiences. He spent time in healthcare, pharma, and in medical devices, which makes him an all-round expert. I mean, all of us have limited knowledge, but I look at Mr. Murthy as one who has got a lot more wholesome knowledge in this. I'll hand it over to you, Mr. Murthy, and we'll you to discuss it.
Yeah. Good afternoon to one and all. And as thanks for Mr. Raghu and to introduce me in a bigger way. And here my point is to again see overall industry. Basically, it's been evolving industry, and healthcare industry is something which is dynamic. And today, the key drivers basically looking into the population and the rising health problems in India and the infrastructure which has been backing up with them has basically health has a key drivers. These drivers are fundamentally reshaping the landscape of public health and infrastructure and services, positioning the sector of a significant expansion and development. Basically, in health and demographic transition, public expenditure and infrastructure development, and integration of technology and innovation, which few of the corporates or hospitals are managing it, but not in the smaller clinics, since there are issues which are concern, challenges, and limitations in healthcare as a whole, looking into the availability of healthcare professionals in India, as well as the registered doctors who have been healthcare professionals in India, and the quality doctors which have been there. And the ranking wise, India stands far below when compared with, as we are talking about the developing countries. And the challenges which are basically coming from the healthcare system point of view is like affordability, accessibility, and care management because of the time constraint, work stress, cost of the treatment, and transparency, and the time factor. Coming to the patient point of view, the patients, as it was mentioned, the first point, stating that the expectations are getting high because the patients are expecting as a limited limited time at the consultations. waiting time at healthcare professionals, the awareness about the disorder, what they are suffering from, and the empathy and emotional contact with the healthcare professionals, and the lack of confidence, and keep on moving to doctors for doctor shopping, for repeat consultation, and the patient retention with the same single particular with one healthcare professional. And of late, because of nuclear families, the elderly patients are because the incidence of mortality as well as the chronic diseases, especially in the elderly patients, are rising. Since nuclear families, the assistance is not there. I think this technology would help them out and stay in contact, and therapeutic outcomes can be achieved, and the compliance can be achieved through the various sources of Zoho and our partners. So, to sum up the everything, so it requires a consistent perseverance from all the directions in using the available resources and technology to minimize and see how best the patient outcomes are achieved and the patient detection can be done. Raghu, you can move. So this is from my end, and in terms of a few challenges from either of the from healthcare perspective as well as patient perspective, which can be dealt in customized level at various levels, and moving forward with the further campaign of these webinars.
Right. Thank you so much, Mr. Murthy. That was insightful on that. Like Mr. Murthy said, there is a whole lot of issues that are related to public infrastructure or kind of thing. For example, I'll just share some statistics. Look, we have something like almost just 1.3 doctors, sorry, 1.3 beds to every 1,000 people in India. This is a very, very low ratio, right? The typical infrastructure challenges that we face in India is huge, right? And even today, when we look at the kind of hospitals, the number of registered hospitals is roughly about 70,000 in India, which is quite small for a population. Our population is also close to 146 crores, right? And we're talking about just 70,000 hospitals which are there is not a great number for us to have. And the number of beds obviously is that much lesser. For every 1,000 people, you're talking about 1.3 beds, and this was very much highlighted, especially during the COVID time, when people were struggling just to get a bed. A basic necessity like oxygen became it was so sad for us to hear and see those people, the patients suffering and struggling to get access to oxygen. Can you imagine how difficult it is for us to say, hey, you know what? The basic things that I need for me to survive, like oxygen or water, and if these are going to be challenges, then we are in a bad shape. So these are things that we need to address as we grow further, go into this whole system. So it's always good to see how patients or how clinics can come up and help in doing this, right? And the whole purpose of moving from let us say infrastructure based kind of focus to be able to say, hey, can I deliver patient care more effectively? And that is where solutions that can help you to reduce your time, reduce your complexities, and ensure that that you can focus best on what are the outcomes that you are looking to deliver, rather than worry about an administrative issue or a billing issue or a complex, a data concern, which are not core to your problems, right? So you have enough problems to try and address the patients themselves. So the ability to spend more time and focus on that will ensure that we can deliver better healthcare quicker, faster, and ensure that we can cover a larger population there. So thank you so much, Mr. Murthy, for this wonderful thoughts. Teja, can you just quickly, we'll walk you through a video, just talking about some of the aspects that we just spoke about. And then after that, we'll have a quick Q&A, and we'll be happy to take questions from the audience. Please go ahead, Teja, play the video.
Not able to get sound.
Yeah, yes, the sound doesn't work on this. That's what we were.
But they can explain now.
Right, Teja, you can pause it. So we're up now for Sunday. You have a question and answer section where you can, put up your questions and then.
To all the attendees, thank you for your attention so far. We hope these real world examples which Raghu provided was extremely valuable, and the insights which Murthy shared was also uh, very much valuable into how Zoho can address the unique challenges of the pharma, healthcare, and life sciences industries. Now, we would like to hear from you. If any particular solution or feature piqued your interest, or say if you are curious about how Zoho could be tailored to your specific needs, please feel free to ask. If you're wondering how Zoho could integrate with your existing systems, or you may have questions about the implementation processes, uh, data security, or compliance, don't hesitate to bring that up. So, like we usually say, there's no such thing as a bad question or a silly question. And we are all here to address any concerns or ideas you might have. So please go ahead and share your thoughts. We would love this to be an interactive session that brings even more value to both of us.
Right. So I can see a question from Amit Kumar Thale, and I'll take that. Yeah. So his question is very simple. Does Hithav help to configure Zoho solutions to specific use cases for hospitals? Absolutely. See, that's the beauty of being able to work with Zoho as a solution, because the ability to integrate it to anything that is available is very high. Not only that, we can customize and ensure that it matches your workflows, it matches your kind of requirements that are there. And again, they need not be all taken up at one time, and we can do them in phases, right? I mean, you can just pick them. Let's say you can pick one to start with and say, hey, we'll do an appointment scheduling, or secondly, we'll start doing a documentation workflow kind of a thing. So they can all be, or your document accounting, whatever you think is a critical thing. So we will sit with you and then work these out. And also to tell you, Zoho and Hithav also we are working on coming up with a comprehensive healthcare solution, which should be out in the market in the next couple of months. But again, that's a little time off on that. But till then, we can always try and reach out to you and figure out what are your requirements, and then see how we can tailor a requirement for your requirement. So Teja, can you just note this down? Maybe once we're done with this seminar, we can set up a time with Anil Kumar and then try and see how we can address his issues on that. I hope I've answered your queries. And then if there's anything further on that, I'll be happy to discuss. Okay, right. Thank you, Anil Kumar.
Yeah, adding to that.
Sorry, there's an echo coming up there.
Yeah.
You are on mute.
Yeah. I think between Karthik and Preetham, one of you all can mute, another one can talk, I think. Sorry, Preetham, you're still on mute.
Yeah, adding to that, I hope I'm audible now.
Yes, very much. Yeah.
Yeah, so we do have existing customers in the hospital domains. Maybe we can email you or give the information one-on-one, and very large hospitals rather, and we have been serving them for more than 2-3 years now. So as Zoho, as a product-based company, even as Hithav told, right, even we are coming up with tailor-made hospital kind of solutions, so that we will explore once we take more info from your end, like what exactly you want us to do there. But yes, we do have a lot of clients in India who are major hospital chains who are using Zoho in most of the areas, like Hithav initially mentioned the pain areas, right? We have a lot of customers using our CRM Plus, which is your sales and marketing tool. There are customers using whole of Zoho one button. So based on the respective use case, we do have customers. Maybe happy to share later on as well, the case studies, etc.
That helps, Preetham. That's a good point, because use cases can help people understand what exactly is the requirements. That makes sense. We do have another question. Quickly, we have it from Pawan. So his question is: can we track the existing patient details, if any reappointment schedules? Would you like to take that, Karthik? Karthik, you're on mute, I think. Yeah.
Am I audible now?
Yes, very much. Yeah.
Okay, so yes, Pawan, you can track existing patient details and re-appointment schedules using Zoho. With tools like Zoho CRM, you can store comprehensive patient details, including their medical history, past visits. You can use workflows to automatically set reminders for reappointments based on previous schedules. You can track follow-up appointments, consultations, and treatment plans in an organized manner. And we do have Zoho bookings, using which patients can schedule reappointments through an online portal, and their previous details will be available for reference. Automatic reminders for both the patient and staff can be set, ensuring no appointments are missed. Right. So these tools ensure seamless patient management, allowing the clinics, hospitals to track, manage, and follow up on reappointments effortlessly. Hope that answered the question.
Right. So, Pawan, I hope that answers your question. Anything more you'd like to know? So, I don't see any response from Pawan. So, we'll any other questions that we can take before we wind up? Teja, can you move on to the next slide?
There is one more question.
Yeah. So we have another question by Balaramayan. Yeah. Can you share examples of how Zoho CRM or Zoho Help Desk has improved patient engagement and satisfaction in healthcare settings? Yeah. Preetham, would you like to take that, or
yeah, so in terms of specific logos or names, we'll probably share it across on one-on-one sessions. But there are some use cases of how Zoho CRM and Zoho Desk have improved patient engagement or satisfaction in healthcare settings. I think that's what he wants to know on a broader note, right? Say, for example, a multi-specialty hospital implements Zoho CRM to manage patient relationships more effectively. So the first thing which happens is personalized and improved communication. The hospital can use CRM to store patient records, track appointment history, and manage follow-up schedules. This ensures timely reminders and personalized communication, leading to a reduction in missed appointments and an increase in patient retention. Right? And with CRM's automation and segmentation capabilities, the clinic or hospital could categorize patients based on conditions, enabling doctors to provide tailored treatment plans and proactive care, improving patient outcomes and satisfaction. And last but not least, data-driven insights, right? So by analyzing patient data from CRM, the clinic or hospital could identify trends in patient needs, refine services, and improve engagement through targeted health campaigns as well. So enhance the patient experience with more personalized care, seamless follow-ups, and improved doctor-patient relationships is the key outcome of using Zoho CRM in healthcare. Since he also had a question around Zoho Desk, say, for example, a healthcare clinic adopts Zoho Desk to improve patient support and inquiries management. So the first thing which you obviously know is the ticketing system for patient queries, right? The clinic could use Zoho Desk ticketing system to handle patients' inquiries, appointment requests, and follow-up questions. This allows patients to receive timely responses and quick resolutions to their concerns. Zoho Desk, when integrated with email, chat, and phone support, it enables the clinic to engage with patients across multiple communication channels. This flexibility, malleability improves patient accessibility to care, right? And patient feedback loop as well. You can use Zoho Desk's customer feedback tools, and the clinic could probably gather patient satisfaction surveys post-appointment, enabling them to address concerns and continuously improve their services. So the outcome being patients would report higher satisfaction due to faster response times, a very frictionless support, and greater accessibility to information and assistance. So both the products empower healthcare providers to deliver personalized, responsive, and efficient care, which would directly have a positive impact on patient satisfaction. I think.
I hope that answers your question, Bala. If there's anything further, yes.
Yeah. Also, Bala, mostly in the healthcare or the hospitals, we have seen CRM Plus bundle used most. CRM Plus includes your CRM, your desk, as well as inbuilt analytics as well comes. Now we have added even marketing automation. So end of the day, CRM Plus will give you the whole 360-degree view of a customer. Let's say he's coming onto the website right from the bot, that is a chat bot, that data coming to your CRM, then through the desk, and then analytic report along with the campaigns, like with the existing customer campaigns and as well as the new campaign. So CRM Plus is what we have mostly used a lot of major hospital chains. Happy to collaborate with you one-on-one along with it to showcase you more examples what we have been doing in the other hospital chains. I also see another question: is virtual feature available in healthcare, like the patient can like video call?
So virtual, like, or do you want to say something? Am I audible? Hello?
Yes, correct.
Okay, I think somebody has asked a question around virtual features, right?
So
So
virtual features available in healthcare, like they can a patient approach through an online video. That's
yeah, I
the
think
question.
yeah. So one thing which comes to my mind is virtual consultations, right? So healthcare providers can use Zoho meeting, that which we use now, to conduct secure virtual consultations with patients. This allows patients to connect with the doctors from the comfort of their homes. Right? And there is screen sharing and recording as well. So doctors can share medical reports, prescriptions, or advice during the session. And the consultations can also be recorded for future reference. Right? And there is online appointment scheduling as well. Right? Patients can book appointments online through Zoho bookings, choosing from available slots for both in-person and virtual consultations, and automatic reminders. Patients receive automated email or SMS reminders about upcoming virtual or in-person appointments as well. So we can go on, about remote patient support, wherein patients can raise queries or seek medical advice via Zoho Desk, which offers multi-channel support through email, chat, etc. But I think there are definitely multiple use cases for virtual consultations and associated aspects.
Right. I hope that answers your question there on that. So that's insightful. It's good to know that we can do this. I mean, today's world, it's nice to see that we can have access to resources even sitting remotely. Well, I mean, if I'm getting grocery delivery in 10 minutes, why shouldn't I be able to access healthcare in a very short period of time? So yeah, makes sense. That's a good question. Yeah. Good. So right. So I think that's any more. I can't see any more questions on this. So I would request anyone has any other queries. We've got our contacts, details available here. We're happy to schedule a call with you, have a meeting, spend one-on-one, and understand your challenges and see how we can come up with solutions. Happy to do this. And just to remind you all, this is the first of the series of webinars that we're doing. We're going to be having many more. We'll probably come up with one on a month. Next one we're planning again mid of November sometime. So we'll of course share all the one is a recording of all this video. Things will be sent to you. One to all the people who have registered, people who have joined, not joined, will get the recording so they can take the benefit of this, even if they missed out today's session. And of course, we'll remind you for the next webinar, and be happy to have you. And then we'll try and address more and more issues as we get along, and then try and see how we can, work with you to improve your practice, your healthcare service, to ensure that moves to the next level, right? And that's the ultimate goal of what we're trying to achieve in this whole series of webinars that we're trying to do here. So thanks everyone, and it's been a real pleasure. And special thanks to our, to Karthik and to Preetham. Appreciate you taking the time off to come and join this whole session, and really good to have you here. And again, another special thanks to Mr. Murthy. He's been our person who has helped us to understand the entire the life cycle of the challenges that we face across multiple domains in the healthcare space. So that's something that we can look at leveraging as we get along down the line on that. So thanks once again for all this, and we look forward to having you all again in the future webinars as we get along on this. Thank you once again, everyone.
Thank you all.
Thank you, everyone.